For those suffering from neuropathy and or balance problem from the neuropathy, I gotta tell you, most people I meet did not know that your nerves can heal. Most people didn't know that. Most people don't know that. And that's fine, and because unless you've studied neuroscience, how would you? So I'm gonna read from a couple studies for you real fast. This is from the Journal of Physiology, which is a peer-reviewed medical journal, and it's been around a long time. I think since the late 1800s. Okay, long. That's what I mean by a long time. This journal. This is from 1943. Now I grabbed this one on purpose because the majority of my patients are born in the 40s, and the point is, what I'm going to tell you about nerve healing and how nerves change, that's not been any different. That's not any different since you were born. Yes, since you were born. So this is still an unfortunate thing that I encounter where I just, let's just get past it real fast because you are suffering needlessly. There are things that are happening and no one's giving you this awareness. No one's telling you this. And so how else would you know? That's why I'm sharing it with you. So again, the Journal of Physiology 1943 says, the rate of regeneration of peripheral nerves. So those are the nerves that go down your legs and in your feet. Okay, the peripheral nerves, the rate of regeneration of the peripheral nerves in man has been so universally accepted as about 1 millimeter a day. What does that mean? It means your nerves will heal. Now, by the way, this is the rate of regeneration of peripheral nerves in man, not in apes, not mice, in man. Okay, so your nerves have to have the normal ability to heal. Now, am I telling you that everyone's nerves always? No, I'm not saying that. I am just imparting to you, if you will. I'm transferring information that hopefully is helpful. Just know that. And I always beckon back and I think about we wouldn't have, where I'm standing right now, I can look out the window and across the street, there's probably stroke rehabilitation. There's a large facility across the street from the building I'm standing in that they probably have stroke rehab, or they have TBI. They work with people that have traumatic brain injury rehabilitation. So I'm just pointing out, logically, we wouldn't have any of that. That wouldn't even exist if nerves couldn't heal. That's the way I think about it. But I wanted you to know. And another quick one. Quick study note. This is from a neurologist at Mayo Clinic. In this study, it says the axons regenerate. So axon is a fancy word for nerve cell. So nerve cells or axons regenerate at the rate of just 1 to 3 millimeters daily. So this is more present day from Mayo. And I just read to you a study from 1943. So it's at 1 to 3 millimeters or a millimeter back. It just means slow. Okay, your nerves are gonna, for some of you and that are lucky enough to get help to get nerves to change, because he goes on into this in this same part I'm reading from. He says peripheral nerves can repair themselves, but they need guidance to do it. And so I'm not giving you pie in the sky. So here's the thing, and here's a quick analogy. If you cut your hand and you're working outside, you cut your hand, whether you put a Band-Aid on it or not, your hand, it's most likely going to heal. And whether it's pretty or not, or it takes a short time or a long time, you put Neosporin, it's going to heal. It's not that specialized. Nerves, we're not so lucky. They don't heal that well spontaneously. And that's the way I would give you an example is, he says, peripheral nerves can repair themselves, but they need guidance to do it. Okay, and then the other point I would lead to from there is, for some of you, there could be therapies that could help provide this guidance. We do a program in our clinic called the Nerve Fit for neuropathy and balance problems. I'm not saying it's going to help you or it could help you, but again, I just want to transfer information about most people I meet don't know that their nerves can heal, and they're out there floundering, and there's real angst surrounding the problem of neuropathy. It's progressively getting worse, and they don't know what to do or where to turn. So I thought I'd just give you some useful information. I hope that point is helpful. At least now you know. If you need anything or have any questions, you can give us a call. Dr. Ryan K. Lewis, DC, 1-855-FIX-FEET. You can call us at, again, 1-855, that's FIX feet, Missouri Pain Treatment Center. Take care. Bye.